Hello, and welcome to this YouTube video series, Autism Spectrum Disorder in 3 Dimensions. My name is James Coplan, MD, and I will be your host. I am board certified in pediatrics, a fellow in the American Academy of Pediatrics, and I have subspecialty training in both neurodevelopmental disabilities and developmental behavioral pediatrics. I have 40 years of clinical experience, including 30 years in academic medicine and 10 years in private practice. You can find out more about me at my website, and I'm going to put the link up on the screen right here. And we will have more to say about me and my own development into becoming a developmental pediatrician in a subsequent post. The primary audience for this series is parents of children on the autism spectrum, but also grandparents, siblings, other types of child care professionals, including educators, health and mental health care providers, first responders, and community decision makers, such as school board members. My purpose, even though you and I will probably never meet in person, is for me to share my expertise with you, the parent of a child on the autism spectrum, so that I can help to restore your sense of competence and your self-confidence that you can become and remain your own child's best advocate. One caveat is that I can't answer specific questions about a specific child, especially a child I've never seen. And bear in mind, I've retired from clinical practice, so I'm definitely not out here on the web trolling for patients. I wish I could see your child, but I made a decision to retire from clinical practice, so that's not going to be an option. But my hope is that I can still give you the general information that will help you along the way, and in so doing, I can enable you to regain your sense of self-confidence that you can remain your child's best advocate going forward. Now, here's an outline of what's in store for the rest of this series. So, we'll start with the most basic question of all. What is ASD? And we're going to talk about a variety of features of ASD as well as the underlying neuropsychology of ASD. Second, we're going to talk about what causes ASD. And if you are the parent of a child on the spectrum, then this question for you really is, why my child? And what is it that caused ASD in my child? And that can be a lot harder to answer. And I certainly won't be able to answer it specifically for you, but I'll be able to give you a perspective on the whole field. Third, what can we expect going forward? This is something that parents are always thinking about. And within that subject, I'm going to introduce you to the concept of the natural history of autism spectrum disorder, what a physician means when they say that a condition has a natural history. And I'm also going to introduce you to the 3D model that I developed, which serves as a kind of a chart or a roadmap of where your child's future may go. And as I've told parents over the years, this is a map of the territory. I can't tell you exactly what path your child will take, but this is the territory as a whole for you to keep in mind as you move forward. And then last but not least, what can we do? What can we do to help your child, or what can you do to help your child? In terms of the question, what is ASD? First, we need to talk about the visible behaviors, because even though this is a condition that's been written about for well over a century, it's still defined not on the basis of a biological marker, but on the basis of outwardly visible behavior. We're going to talk about Langdon Down, who is an Englishman from the 19th century who gives us the first written description of ASD, almost certainly ASD, although he didn't call it that. Then we're going to talk about Dr. Hans Asperger and then Leo Kanner. We're going to talk about the DSM and the various pros and cons of the way the DSM has tried to define ASD. We're going to talk about the so-called explosion in the number of individuals identified as having ASD. And then we're going to talk about what's under the hood, the neuropsychology of ASD. What are the processes going on inside the brain from a cognitive or psychological standpoint that we believe give rise to the outward symptoms of ASD. And within the domain of neuropsychology, we're going to talk about something called theory of mind. If you haven't heard of that before, this is an incredibly important concept, and it's fairly simple to get across once we get to talking about it. We're also going to talk about the concept of central coherence. Again, it's kind of a highfalutin term for a concept that's really pretty straightforward once you get right down to it, and it's a major issue for people on the spectrum. And then finally, we're going to talk about the mirror neuron system and how issues with mirror neurons may play into the whole picture. And we're going to take all of these different features, and we're going to wrap them up together under the rubric of atypicality. And we're going to use that general concept of atypicality to include our definition of ASD and the clinical features and the underlying neuropsychological traits that we feel lead into ASD. In terms of what causes ASD, we're going to talk about possible prenatal causes, perinatal, in other words, around the time of birth, and postnatal, meaning events following birth. But you'll notice there's a big kind of a blank spotted here, and that gets occupied by genetics, because far and away the most common cause, the most common identifiable cause of spectrum disorder is wrapped up with genetics. Then moving on to what can we expect? There's a whole range of outcomes, and these outcomes are incredibly varied. My acquaintance and colleague Stephen Shore once remarked, if you've met one person with autism, you've met one person with autism. And Dr. Shore is exactly right in that regard. We can talk in some degree about generalities and things that are true across the board, but any given individual on the spectrum is truly unique, and we need to look at that person as an individual, not just as a statistic. The best possible outcome within this range of outcomes is independent living, fully employed for IQ, and this, of course, is the goal we shoot for and hope for. Unfortunately, or a lot of quote-unquote high-functioning individuals with high-functioning ASD achieve independent living status, but they are tremendously underemployed for their level of intelligence, and we'll have a lot to say about that when we get to that point in the series. Next step down from that would be people who are in supported community living. It's very normalizing to go to the store, to go to a restaurant, to be in the community and interacting with everybody else in the community, but with some degree of support. And then there are individuals who have severely disabling cognitive, social, or mental health issues that may significantly interfere with their ability to function in the community. And some of these individuals, sadly, may require some degree of institutional support, either from the developmental disability or mental health system. And even more sadly, some individuals get caught up in the criminal justice system, and that's something else we're going to have a few words about later on in this series. Probably the worst possible outcome is depression and suicide. And this is a significant issue, especially, again, for individuals with high-functioning autism. We have data from the Scandinavian community that speak to this, and this is something else that we're going to talk about when the time comes. Now, you'll notice up here we show IQ. Now, there's nothing in the definition of spectrum disorder itself about IQ. But IQ is the silent partner that has a lot to say about where in this range of outcomes the individual winds up. Even though atypicality and IQ are totally separate entities, we need to look at the joint impact of these two factors when we think about outcome and when we look at our three-dimensional map. And again, we'll get back to that as we go along in this series. Mental illness also plays a huge role in determining outcome. And when we look at the conjunction of atypicality, genetics, and mental illness, it's also true that any given child on the spectrum has a 50% chance that at least one of his or her parents is going to have some kind of a mental health issue. So we need to look at family health, not just the mental health of the parents and the siblings of the child with autism, but family functioning, because family functioning also has a huge amount to say about long-term outcome for the individual on the spectrum. What can we do? Well, we can talk about child-focused interventions, and here I'm going to introduce you to a term or a pair of terms, bottom-up and top-down, and I won't get into what those terms constitute right at the moment, but we'll get to those. And we're going to talk about applied behavioral analysis and OT as examples of bottom-up intervention, educational services, social and community skills, mental health services, and then from more of a top-down perspective, we're going to talk about medication. We're going to look at parents' mental health and family health. And then finally, or at least I say finally as a pediatrician, but it's really only a move to the next phase of a person's life, transition to adulthood. And this is something that I used to begin talking to my families about in the office at the second or third visit, when the child is still a toddler or a preschooler. That may seem a little bit premature, but the time to begin thinking about transition to adulthood is really as soon as you've caught your breath from getting the initial diagnosis. Well, okay, that wraps up my first post. You can catch up on some of the other things that I've written and some of my previous public speaking engagements by going to my website. There are links to various talks that I've given and presentations that I've given, and I look forward to seeing you back next week. Until then, thanks.